afternoon, everyone. First of all, I'd like to thank you all for being out here, showing your support and dedication to Kathy and all the members of JASA. For many of you, the facts on autism has already been defined. Many of you come here informed, and it's basically just maybe an update. But for you, I want it also to be that you go out there afterwards to tell everyone else. So we know that autism spectrum disorders, as it is often called, is a triad. 3 things make up the diagnosis, and that is an impairment in social interaction, the way how we sometimes not look at other people when we speak, how we don't have as much facial expression, or just the range of our facial expressions and gestures may be more limited than typically. There's also an impairment in language, and this ranges from the most mild ones, where we may just not understand figurative language, but where we may have lack of or delay in language, as well as loss or regression of language. And there are also the repetitive or stereotype behaviors, and these are the ones that people seem to be most familiar with. They tend to remember a child who is flapping on television or screaming or just behaving differently. But remember, this is only part of what makes up a diagnosis. It is not what makes up a child. The prevalence of autism has been increasing over the years. And as Mrs. Chang said, from 2000 to up to 2008, where the last CDC statistics were from, this has gone from 6.6 per 10,000 to 11.3 per 10,000. And by itself, it may not seem such an important figure. But if you translate 11.3 per 10,000, it becomes 1 in every 88 children. And that means for every 88 children, there will be 1 child affected. And then if you're a boy, you're even more likely to have that diagnosis than if you're a girl. Because we know that boys are affected much more than girls, at a rate of 4.7 to 1. The presentation, as I said, we often see is language. And most parents will make it their point to come to the doctor and say, my child is not talking. But many times we wait until the age around 2 to 3 before we make that move. Whether it's because of fear, whether it's because of hoping for something else, or whether we're just not as vigilant, may be some of the factors that bring this at such a late stage for diagnosis. However, at about 2 to 3, this is when most parents will present, language being the most important of all things, because now we're trying to look forward for school. Besides loss or lack of language, we'll also start comparing where my child doesn't play. Everybody else is playing their games and they're pretending to be cops, robbers, Batman, or Superman, yet my child will stay in a corner and maybe line up the toys. Here comes the repetitive type behaviors. But we must remember that the autism spectrum disorders is nothing but a range of different typical behaviors. And even though the most severe will come forth first, there are also those who have minor presentations and will not have a diagnosis until much later, until 9, 10, 11 years old, when the social parts of language now become important. We know that early diagnosis is the key to achieving better outcomes. And we all know that intervention for us comes at a cost. There is minimal that is being provided at present in the government or public sector. But we also know that Jamaica is not the only country where this occurs. And we know that resources are scarce even in first world countries. As such, I ask all of you today to stand together, learn about our children's development, not just about an autism spectrum disorder, but in all areas of development. Know when to expect a child to sit, stand, walk, talk, and be vigilant. If your child doesn't do it, get to a practitioner and insist he's not walking. I do not wish to wait and see. Not because he's a boy, he should be doing the same things. Being vigilant means that we're able to identify any concerns and hopefully we'll take that step to getting an early diagnosis and being able to provide some interventions. Let us be advocates of our children as we educate and inform and demand for ourselves and our children placements in schools, interventionists, and long-term care. Thank you.